this patient was referred to me for endodontic treatment of tooth number 21. Patient was referred to another endodontist, and the other endodontist had tried to do this root canal, couldn't do it. Patient freaked out, he panicked, and couldn't handle the procedure. So patient was referred to me so I can IV sedate him and do the root canal. Porcelain crown, irreversible pulpitis. Going through a porcelain crown. Couple pictures of the tooth and go over some instructions with you, okay? Very good, thank you. All right, so we're through. We're through the crown. There you go. Nice and clean. Right through the porcelain crown. Took me less than a minute. Now let me have the regular, the thin diamond. All right, so now we're just going through. We just went through the crown, and now I'm right into the pulp chamber. I just unroofed the pulp chamber. Okay. Number 20 flare file, and I brush with it, and it's going all the way to 20 millimeters. So I just did my coronal and mid canal flaring with the number 20 flare file. So I'm pretty much done. And as you can see, all kinds of stuff comes out, and I just brush with it and pull out all the pulp tissue. Look at that, it's all coming out. So I brush with it and pull all this stuff out just to make sure that I'm not number 20 flare file. And I don't have anything, by the way, in this tooth. I'm just using the pulp's juices to do my instrumentation. There you go. Now I'm gonna go ahead and use my apex locator and get the working length. Number 10, 24 millimeters to my estimated. I didn't like the way my apical area felt like when I was taking the working length measurement. So I'm gonna go maybe half a millimeter longer to make sure. And I'm brushing with even with 10 file. There you go. All right, I'm gonna get the, thank you. So here's the mid-op, the working length x-ray. I usually don't take working length x-rays, but in this case I needed to take a working length x-ray. The apex locator wasn't giving me a good reading, so I wasn't sure. So I immediately stopped, took a PA, and confirmed my working length, which is 24 millimeters here. I'm using my flare now to my working length now that we took an x-ray, working length x-ray, because our apex locator wasn't giving us a good reading. And that happens sometimes because of different reasons. I'm just brushing with the flare, as you can see. Brush. That's the white 8 teeth, white, 24 millimeters. Let it slide to working length. I'm going to inspect the flutes, and I can see that I got a little bit of denting, shaving in the flutes right there. So that's good. Those let me have the yellow, or as Dulce calls it, jello. And red dose. Yellow, after yellow, red. This is red. 24 millimeters. Let it slide to working length. I'm not forcing it. So you want to put this like that. So fitting the master cone. And this is what I'm dealing with. You see my phone is blowing up all day long because of you guys. Just all day long. You guys, but you're blowing up my phone all day long. All right, so let's see. I'm at 25 right now, so that means that I need to cut a millimeter. So Kim is gonna give me my scissors so I can cut a millimeter. Excellent. And I'm gonna test this again. 224. I should have a tug back. And I also use manual activation as I'm doing this. Why not? Why the heck not? Manual activation. So let's see if I'm going to 24 now. I'm at 24. Yeah, 24. Perfect. So this is it. I'm ready. Final rinse with 70% isopropyl. Thank you. Sterile paper points. And I'll 24 millimeters. Perfect. Here we go. Pulse up the canal with sealer. All right, that's it. GP. Turn it. Dry the GP. Coat it with sealer. AH plus. Take a look. People say they have a hard time with this. The whole gutta percha comes out. If the whole gutta percha comes out, that means that you didn't have a good tug back. That's why you pull the gutta percha out with your heating unit. Okay, number 2 chamber, the pulp chamber. We're gonna air it. All right, sterile sponge. Help of this, see? There you go. There you go, see? Just like that. That's nice. All right, let me have the condenser again. I don't need cavet. I don't need cavet. That's plenty of cavet. Just hold on to this.
This is only for molars.
Here's the post-op. So take a look at this beauty. Oh my goodness. Look at all of this anatomy. There's so much anatomy here. Wow. Wow. 3-dimensional instrumentation, irrigation, and obturation. Gives you an amazing result like this. And you saw how I do my root canals. So this is no magic. I've shown you everything step by step, every single step I've gone over, so you know exactly how I do my root canals. You can also get results like this.